But I do have 2 o'clock, so we will go ahead and get started. Again, we are recording this, so for folks who may have to pop in a little bit late, we do have several more who registered to join us. We'll go ahead and send the link to everybody for this. So I will first apologize for any construction noise you may hear in the back. I took the opportunity to come into the office today, and we're under a little bit of construction. So as soon as I go on mute, any of that humming you hear will go away. But welcome everybody. I'm Julie Sanderson, and I am the event director for the Toledo Regional Chamber of Commerce. And thank you for joining us. You know, as we advance the effort to educate, motivate, and vaccinate the entire Northwest Ohio corridor to dramatically slow the spread of COVID-19 virus, we will continue to provide the region's business community with the latest information regarding COVID-19 vaccines. This is our second round of vaccination clinics or sessions that are updates for business webinars. And we are working in partnership with the Employers Association, the V Project, and the Toledo-Lucas County Health Department. So many thanks to them for their partnership in this. Once again, we have assembled a panel of expert speakers to provide an update on where we stand as a community on COVID-19 and the vaccinations, and to answer your questions on the legal complexities of vaccinations in the workplace. Terry will introduce those speakers to you in just a moment. But one update you will hear in this series is about open and closed vaccine points of dispensing, or PODs as we call them. Including an orientation, some basic expectations, some assistance with paperwork, and signups for pods and closed pods. You will hear from business leaders in this series who have held their own vaccination pods, and will share some best practices and lessons learned. And why are we focusing on pods in this session? Well, first, we heard it from you in our last series that there was interest and questions on how to activate or support a pod in your business. But also, we know the landscape of the vaccination journey is continuously changing, and one change is the availability of vaccines and the number of people yet to be vaccinated. I heard an analogy on a webinar with the Ohio Chamber and the governor's office that illustrates this a little bit. So this isn't my analogy, but I do want to share it in honor of Mud Hen's opening week here this week. Early on in the vaccination process, sites critical to vaccinating people, early on in the vaccination process, the max vaccination sites were critical to vaccinating many people quickly. Bases loaded, home run, many vaccinations with just one person at bat. But now, to continue that effort, it's like base hit after base hit. The endeavor will be smaller in smaller measures, but as long as we keep hitting base hit after base hit, we will continue to advance the runner and score, and getting us closer and closer to that goal of 70% of vaccination that medical experts say will allow us to be safe and help our businesses, organizations, and community members all thrive without restrictions, something that is important to us. With that note, I do want to recognize Lou Cook from the governor's office, who's joined us today for this. And Lou, it was on a webinar that the governor had put forward that I got that analogy. So feel free to share that I am sharing that analogy that I keep hearing. I will now introduce Terry Vanier, who is the seminar learning manager at the Employers Association, to introduce today's panel of speakers.
Well, thank you, Julie, and good afternoon, everyone. Today we are pleased to have with us for this session Brandon Palinski and Greg Moore with the Toledo-Lucas County Health Department. Brandon has a Master's of Public Health, Veterinary Public Health from The Ohio State University and has been working in the public health field since September of 2013. Brandon serves as the Toledo-Lucas County Health Department's Planning and Quality Improvement Administrator, leading efforts to maintain public health accreditation status and driving quality improvement, performance management, and strategic planning efforts. He's been trained by the Center for Public Health Practice at The Ohio State University as a performance management peer coach to provide technical assistance to Ohio's local health departments on performance management, and successfully completed the Mid-America Regional Public Health Learning Institute's year-long fellowship designed to strengthen and promote each fellow's core leadership competencies and skill sets. Greg Moore is the Healthy Start Program Coordinator for the Toledo-Lucas County Health Department. His current responsibilities and his response during COVID include the management, coordination, and evaluation of the Healthy Start grant, contact tracing, pod volunteer, and open and closed pod orientations for agencies. He's worked at the health department for over 14 years. His roles and experience at the department have included maternal child health epidemiologist, alternate clinic supervisor, project coordinator, accreditation coordinator, regional public health coordinator for Northwest Ohio, bioterrorism coordinator, and backup public information officer. Greg earned his Bachelor of Science degree specializing in healthcare supervision from the University of Toledo and his MBA in organizational leadership from the University of Findlay. Also with us today is Amy Luck, partner with RCO Law. Amy practices in Ohio and Michigan with a focus on employment law and litigation. She joined RCO Law in 2017, having practiced in Kansas and Missouri since 2005. Amy assists employers with all aspects of the employment relationship, including employment policies and handbooks, audits and investigations, wage, hour, and benefit questions, and defense of employee claims at the administrative level and beyond. Amy's a member of the firm's COVID-19 support team, which has been providing legal counsel related to COVID-19 since the pandemic began more than a year ago. Amy earned her Bachelor of Arts degree from the University of Northern Iowa and her JD from the University of Iowa College of Law. We also have with us today Laura Bowles, the Director of Global Benefits at Dana. In this role, Laura is responsible for managing employee benefits and costs for the corporation's 36,000 people in 33 countries around the world. In addition, Laura is responsible for Dana's employee wellness programs. Prior to joining Dana in 2020, Laura spent 21 years at Borg Warner in Auburn Hills, Michigan, beginning her tenure as a benefit specialist and ultimately being promoted to Director of Global Benefits. In addition to her corporate life, Laura also served as a contract professor at Ball State University. Laura earned her Bachelor of Science degree in Management and Marketing from Purdue University and her MBA in Human Resources from Ball State University. We're honored to have each of you with us this afternoon, and we truly thank you for taking time to share your expertise with us. At this time, Julie, I'll turn it back to you.
Thanks, Terry. And before I turn it over to our panel, just a reminder to keep your microphone on mute to reduce any background noise. And also when it comes to questions, feel free to go ahead and put those in the chat or make a note to the side. We'll wait till the end until we've heard all of our presenters, as there's a good chance your question might be answered throughout the presentation. And Bob Bethel from the Employers Association will lead us in a Q&A afterwards and moderate our speakers through. So, and as I said at the beginning, we are recording this session, and I'll go ahead and send the link out to everybody when it's done, usually 24 to 36 hours. So we also know, and our speakers can attest to this very much, this is an ever-evolving conversation. So please note that what is being shared today, this is our timestamp, is current and accurate as of today, May 3rd. So with that, I know Bob will lead us through the program, but we will get started with Brandon. We do know that. So Brandon, I'm going to unshare my screen so you can go ahead and get started.
Okay, that sounds great. And I'm going to click here, and everyone can see that okay? Very good. So I like to give this update. I did this in the previous webinar series, and if anyone has questions, please do feel free. Okay, so one change, correction. Our total cases for today are 41,756. Off the top of my head, that's the one value I didn't change when I was doing calculations of how many plus or minus, but That is almost 4,000 new cases since our last webinar on the 31st of March. We have had, unfortunately, 831 deaths in the county, 36 since our last update, and we have given at least 182,000, almost 183,000 tests in our community. That number is actually low to the true value because testing sites are not required to report all tests to us, but a lot of partners do, and we really appreciate that. So that's where that number comes from. A new data point that I've just added is our community positivity level. So this is calculated primarily at the state, but we also learn from our hospital partners what they're seeing inside their systems. On a report this morning, hospitals are seeing roughly 6 to 9 to 10%. Our community level, as of the last update at the state level, was 10.1% positivity. Obviously, we want that to get as low as possible, with around, I think, 5% being one of the markers of opening stuff more freely and just keeping it down at that low level. If you do have someone that you know or in your business that may need a COVID test, we do have a list of providers on our website. You can go to that link. Really, just if you go to our website, lucascountyhealth.com, you'll find your way there. But that is the direct link to those testing sites. In terms of the cases we've seen, over the last 14 days, we have started to see a decrease in cases per day, which we love to see. Our average is sitting at about 78 in a fifth. That's down from about 100 the previous 2 weeks. And of course, that's way down from our peak during the pandemic of about 300 cases a day coming in. So we're happy to see it trend down again. We did have that uptick for the past 2-3 weeks that we were hoping wouldn't get too much higher. And it does seem like we are starting to trend down a little bit again. One of the things that I think is very sobering to see is all of our cases in a single graphic. And that is this chart. Each one of those green bars is the number of cases received on a single day. You can see in November and December, we hit upwards of the almost mid 400s on a couple days there. So that was really the peak pandemic here. We came very far down from that into January and February. You can see moving into April, we did have a slight uptick again. And as I said a moment ago, we're starting to see those come down again. We're hoping it goes down further, but this is kind of that wave pattern that we've seen with cases and outbreaks in the community. So we're always hoping that everyone does everything they can to lower this case volume and that we can all get back to more normal and eventually completely normal. This map here gives a kind of a per capita view of the last 2 weeks in our community. So this was yesterday's. You can see that towards the eastern part of the community of Lucas County, cases are a little bit higher at the moment. And this is per 5,000 residents in each jurisdiction to standardize how this graphic looks and compare those zip codes. So this is where we're sitting as of yesterday. Hopefully today we'll show a little bit of the brighter colors, get away from those blues and purples. But we are seeing that trend down and hopefully that continues. In terms of the vaccine variants, we do now have these 4 variants in Lucas County. And I have the numbers, the most recent numbers. California, there we go. It was on a transition. These are the most recent numbers. One of the most concerning is that Brazilian variant. Some of you may have seen that the early research coming out of Brazil shows it is affecting younger individuals more severely than the other COVID cases have, or the other COVID variants have. And the UK variant is now almost 60% of cases nationally estimated. So that is more or less become the dominant variant circulating in our country. And hopefully the other ones don't. All of these variants have at least some increased transmission, up to 50%, down between 20 and 50% increased transmission versus the original COVID strain, with a few of them also showing a greater degree of reduction in antibody effectiveness. So of these variants, some of them, whether you have naturally acquired immunity or vaccine acquired immunity, some of these variants have shown that that is not as effective, although any immunity is still better than none, as I'll talk about just briefly in a moment. So with those numbers, obviously, and this is my standard plug, anyone who sat on these has seen the slide a million times. You could probably recite the slide word for word at this point. The gold standard measures, please still wear those face coverings when you're with individuals who aren't vaccinated or you don't know if they've been vaccinated and are fully vaccinated, the 14 days past that second or last dose of vaccine. Please social distance when you can, especially when you are not around individuals you normally associate with. Hand washing is obviously one, but one of the biggest ones is if you're sick, please stay home or please make those accommodations, because the biggest way COVID is spreading is, oh, it's just seasonal allergies, or oh, it's this. And if you have that suspicion, get a COVID test. If you have some of the key hallmark traits, a new or worsening cough, that the wonderful loss of taste or smell, some of those really big ones, please stay home and just consider talking to your doctor, because that is the way this is really spreading. And again, if you receive a call from one of our wonderful contact tracers, we ask that you please indulge them, and that helps us prevent further spread in the community by doing that process as quickly as we can. Okay, for vaccination in the county right now, these are yesterday's numbers, but we have vaccinated over 171,000 individuals with their first dose. That's 40% of the Lucas County population. We've actually given more vaccines than that. This is just of residents. And we've, of course, have vaccinated individuals from Michigan, from Wood County, from all our surrounding counties and communities. And we are up to 144,000 of second doses provided. So that's, oh, one too far. That's a little more than a third of our population here. And you can see that we've given a substantial number of vaccinations since the last update on March 31st. One of the trends we're seeing, though, and this is one of the things we want to communicate, is vaccine interest has dropped precipitously. All the individuals who really wanted to be vaccinated were in those first couple waves, and we've gone from the peak of about 13,000 in a week down to about 1,500 in a week across all our partners. So we really are seeing a much lower level of vaccination. Greg's going to talk about the closed pod process a little bit, and we are moving into that phase as well, just to try to get anyone who can be vaccinated to be so. Anyone on the fence, we want to convince them that this is the best way to protect you, your family. All the vaccines offer cross protection to those variants. So again, it may not be the variant strain that the vaccine was designed against, but the immunity given from vaccination has shown that cross protection, so that individuals who do develop COVID after being vaccinated, it's usually a much less severe illness and a much lower risk of hospitalization and even lower of death in those cases when individuals have been vaccinated. Understanding the difference between the vaccines, J&J, I think everybody knows this at this point, is a 1 dose, Pfizer and Moderna are 2. And you can see the general effectiveness in that chart. If anyone does need to schedule vaccination, you can do so either at gettheshot.coronavirus.ohio.gov or through the Lucas County Health Department website. It links to the same place. I think our link's a little easier to remember. So certainly go whichever one makes you comfortable. You schedule, you would fill out their initial thing. Generally, we tell people to fill out the Maumee area zip code, although with other pods happening in different locations, you could try other zip codes, but there is a radius limit of about 20 miles. So if you enter a zip code that's on one of the edges of the county, you may not see a point of dispensing site that's available somewhere else in the county. So anywhere central is usually a good zip code to plug in there to find those things. Then you'll find an appointment, schedule, etc. So that is the main of this. I do want to also say that the health department is having 3 additional walk-up COVID vaccination clinics tomorrow. We are doing that at the, let me actually open the press release so that I get all the details correct. We're holding those at at Savage Park, Friendship Park, and Jamie Farr Park from 9:30 a.m. to 2 p.m. and that'll be Pfizer at those locations. We also will be hosting a walk-up clinic at the Lucas County Rec Center, Hall 2 tomorrow. Again, Pfizer. That clinic will run from 9 a.m. to 6 p.m. So we do have those walk-up clinics in addition to those other pods listed on our website. Please talk to your friends, family, coworkers, consider getting vaccinated. We're happy to answer any questions we can if you're on the fence about it. But that really is what we're trying to promote, is individuals talking their friends, talking their family, saying, hey, this might be the best way to protect ourselves moving into the future. So that is my update for now, and I'll turn it back over to Julie.
Thank you, Brandon. And you did just send me that news release, and I will make sure that I send it. I think I had sent the other week of May 3rd out in the emails about this, but I will make sure that everybody on this call has that one as well. So, Bob, if you'll lead us through.
Yes, Greg, you're up to give us some information from the health department about pods. So
Sure.
Feel free to share your screen.
All right, give me 1 second. Can everybody see that?
Yes.
All right. Well, good afternoon, everybody. I'm going to talk a little bit about closed pod planning today, and just kind of give you a quick overview. And this is something maybe to consider for your agency or your business. So what is a closed pod? I know they discussed before, a pod is a point of dispensing. So essentially, whether it's an antibiotic or a vaccine in this case. And as Brandon alluded to before, we have a lot of open pods. So basically open means it's open to the public. Anybody can show up. Whereas in a closed pod, it's very specific. So it could be your employees, your partners, your staff, and you could even allow families of your employees. So if you do decide to have a closed pod, you could consider actually having maybe another location of your job to come in and have that point of dispensing, or even their families. And even if you have some additional partners. The benefits of being a closed pod is, depending on if you have an emergency preparedness plan for your agency or your business, it will complement that. You can add that in. Obviously, it assures the safety of staff, family, and clients as you have folks that come into your agency or business. Demonstrating your employer commitment to staff and clients. And then I think a big thing too is that employees don't have to miss work to attend the open pod. They actually are coming into work and getting that vaccination. The other benefit is potential connections of resources. You're working with your community partners, the health department. And for the most part, it's pretty simple to have a closed pod at your agency or business. Basically we're looking for the agency to provide tables and chairs, pens, markers, highlighters, and signage. And obviously, if you don't have those types of supplies, we can also bring those if needed. As far as employees needed to assist, typically we have like an IT aid. So Wi-Fi's usually used with all the information that we have to enter in. And then we have like a site liaison that will be that main point of contact that we'll reach out to kind of help in that planning. And then depending on how big your closed pod would be, it would be your choice whether you'd want to have security. So essentially how it would work in this instance, and everything's a little bit different now with the vaccine, we would actually, either the health department or one of our partners, which I think currently is Mercy or ProMedica, would work with that site liaison to plan that closed pod. So we would contact them. We would go over whatever paperwork's needed to be filled out ahead of time. And then the health department or the partner would actually bring that personnel, the vaccine supplies. So even whatever we needed to store the vaccine in, we would take care of all of that. And then the employees or family and partners could come to the site to obtain the vaccine. And then essentially, depending on what the priority is at the time, whether it's 16 and over, we could vaccinate those individuals right there at the closed pod at your business or agency. Some of the questions we usually get in closed pod planning are, the legal concerns, the liability. So there is a Preparedness Act that covers a lot of that information and limits that liability. Of course, we do have access to different specialists and prosecutors that can answer some questions too if we're unable to answer them. So always, as you go through that closed pod planning with our partner or the health department, bring up any of those questions that you might have, especially with liability. We'll try to get them all answered before we would hold that pod. And then it's pretty simple. If you are interested in moving forward, or if you want to learn a little bit more, kind of go to that same website that Brandon spoke about, lucascountyhealth.com/COVID vaccine. You'll actually see a link that says business/organization vaccine clinic interest sign up. You'll fill that out. And then typically within 2 weeks, somebody will reach out and contact you. And then we'll just work through the process, the planning. You know, sometimes there'll be diagrams, you know, what's the best location to have it at your agency or business. And we'll work all that through. And it's kind of a short little presentation, but it's pretty simple. So if you are interested in a closed pod, like I said, go to that website, fill it out, and then we'll reach out and contact you. Eileen Thompson, who is also our disaster planner, she's the main contact, and I've been helping to support her with the closed pods effort that we're doing in Lucas County. Thank you.
Okay, thank you, Greg. Good information. Sounds like it is pretty simple. So Laura, if you want to join us here now and tell us about your experience in dealing with it. Was it as simple as Greg made it sound here?
Absolutely. So I know Julie's putting my slides up, so thank you.
There we go. Yep.
You can go ahead to the next one.
Okay.
So I put kind of our long timeline on our vaccine journey, and I promise I won't go through all of this. But I wanted to just kind of point out, you know, through this, we've been kind of all over the place as far as how we were going to get vaccines for our employees. Whether it be, we were going to buy the vaccines in the beginning, and obviously that wasn't an option because of how the government purchased and distributed the vaccines. But we then went to talking to our health provider, our health insurance providers, CVS, Walgreens, all the retail pharmacies, some other wellness programs, and you know, kind of went through the whole gamut of the different options. And then also the different states had different rules on how you could manage the pods. So I think we were lucky in Ohio that we probably had the easiest groups to work with compared to some of our other states. So we were very appreciative of that. But just before I go into our local journey, I just wanted to share a couple other things that we did in other locations for people that might be interested. But we did host with health departments closed pods in our Illinois and Tennessee locations. We've also, again, because of some different state guidelines have had, the health department had appointments for some of our employees. So they couldn't come on site, but they held appointments for us. And similar with Rite Aid in Pennsylvania, we didn't have the volume of people to have an on-site pod. So we had booked specific Dana booked hours at a local Rite Aid that we were able to send people to as well. So just a couple different options that we've used at some of our other facilities. But in the Toledo area, we were able to partner with Rite Aid to do a pod on site. And they have been fantastic to work with. And to Greg's point, it really is a pretty easy process. So Julie, if you want to go to the next slide, just kind of our process and how we went through this. So we did work with them. There was some legal forms that we had to fill out for liability that we both signed. But basically what we did is we sent out notifications to our employees and had them register before the event. Obviously, because when we did this in March, the vaccines weren't quite as available as they are now. So we had to make sure there were enough available for the facilities. And then we also opened it up at our mommy facility to spouses, because again, at the time it was age 50 and above. So we were following the state guidelines, but we did open it up to spouses. And we weren't able to do that in our Toledo facility, just again, because of logistics. So you have to really keep the logistics in mind as well. But as we registered the employees, we sent them the logistics for the day, the vaccine information. So we had the Pfizer vaccine. So we had some information we sent them about the Pfizer vaccines. And there was a patient screening form that we sent to them and asked them to complete before they came on site. And obviously, our employees in the Maumee facility have been working remotely. So we did a reminder of all the COVID vaccine, or I'm sorry, the COVID protocols, just as they're coming back in the facilities, the things that they needed to do. And we scheduled, we had three pharmacists, and we were able to do about 55 to 60 employees an hour. So, and parts of the time we had two to three, depending on the level of people. So if you want to go to the next slide. So the day of the clinic, Rite Aid did come in early and they started preparing the vaccines and all the cards. So we had those ready to go. We had the employees check in and validate they had all their information on the form. And if they didn't have any issues, they went straight into the vaccine line. If there were issues, and most of these were people didn't have their insurance numbers. So they did have to give their prescription insurance number. So we helped them find out what that number was and make sure they completed the form. But that was the main thing we found with the forms. Rite Aid did a final review and then directed people to the vaccines. And then this was the trickiest part for us, and I'll talk about that in the lessons learned, but was the people waiting for 15 minutes after the vaccine. Again, just to make sure there's no side effects. And also at that time, we had already scheduled 21 days out. So we were telling people of the next event. If you want to go to the next slide. And don't laugh, this is the HR drawing of our layout. But basically people would check in and we had a line to keep the 6 foot social distancing, but we did have the form assistants to the side. And then when they came in, there were seats to wait for the next available pharmacist to give the vaccine. And then once they got the vaccine, they went and sat in the waiting area and then they exited out of that door. So we did have some privacy for the vaccines, but I don't know that it's necessary, but we went ahead and did that anyway. So some of our lessons learned, Julie, if you want to go to the next slide. Definitely the participation, which was much higher when spouses or dependents were allowed to participate. So if you're going to do one, include as much of the family as possible. We also, especially more in some of the manufacturing facilities, we had people that were hesitant to sign up if we put a sign up out in the area because they didn't want people to know that they were scheduling to get the vaccine. And a lot of it, kind of talking to people is more political than anything. So, we've tried to keep it a little more private. The other thing was ensuring people keep to their appointment times. So we didn't have specific appointment times, but we went by birthday. So if you were born January through March, you came in between 9 and 10. And I didn't put this on here, but a lesson learned is don't schedule during spring break because everybody's trying to get in early. So that's why I would say watch your timing of when you schedule it and how people were coming in for their appointments because everybody wanted to leave for the holiday weekend. And then the issue for us is because we've been working remote for so long, as people were coming in that 15-minute waiting area, they hadn't seen each other for a year, person to person. So there was a lot of, catching up and, glad to see you, those kinds of things. So we really had to watch, keeping people to their 15 minutes and social distancing because they didn't want to obviously kind of move the chairs from where they were to get a little closer. But I think overall we had good response from our employees. Rite Aid was very happy with how things went. And we're just so thankful that we were able to work with them. It's been a fantastic opportunity. And I would say our employees were very thankful. And a lot of them, even talking to a couple of them yesterday, were said they probably wouldn't have gotten the vaccine as quickly if they couldn't come on site because there was a comfort level of going to a Dana facility with Dana people and knowing where they were and just, you know, kind of being in a familiar setting. So there definitely, I think, is something, if you can do a clinic on site, it goes a long way with the employees. And I think it will help with getting people vaccinated as well.
All right, excellent. Laura, I'm going to ask you one quick question before we go to Amy on there. So Amy, I'll promise I'll give you plenty of time here, but one question that I've heard come up about these closed pods for employers is a concern with, you know, getting a bunch of people all vaccinated at the same time. If you ended up with people who had some side effects from the vaccine, and, you know, I know some people did, some people didn't. I had a sore arm after my first vaccine, and that was it. My 29-year-old son was in bed for the day afterwards when he did it. I told him he's much weaker than I am, but that's another story. So did you have concern with that, or did you have any problem with that?
We did, and it's definitely something we talked about, especially again at our headquarters. It's not as big of a deal because people are working remotely, but in the manufacturing facilities, we've had a lot of discussion around that. Yeah. We were able to schedule the pods on Fridays. Okay. So that if somebody did have side effects, it was on a Saturday. I mean, we are 24/7, but the impact is less if people missed. But we did, especially where some of our other locations where we couldn't get them on Fridays, we tried to stagger and have, you know, 2 different days that we would do it. So we might do it on Wednesday for the first group and Thursday for the next, or Friday or whatever the next group. Okay. But yeah, that's definitely a concern. And first shot, I had no issues, but the second shot kind of, it kicked me a little bit. Yeah. So. Yeah. Okay. All right. Very good. Thank you. And we may come back with some other questions for you after Amy's done here as well. So sure. Amy, if you want to let us know what the legal considerations are that we should be thinking about if we're going to do this.
Sure, will do. Can everybody see that PowerPoint? Awesome. Thank you, guys. And that was a really good question. I like that you thought to stagger, Laura, and you thought to try to schedule it on Fridays. I know Fridays seemed like they were the most taken vaccine scheduling early in the project. So that's smart. Okay, so we're going to talk now about legal considerations, especially for those that are thinking about mandatory vaccinations and kind of some of those consequences. So we're back to what would be the reasons you're requiring the vaccine for your workplace. Think in terms of that work environment and who your employees are exposed to. Are they exposed to vulnerable populations or individuals who can't be vaccinated? I go back to the same examples of, you know, medical care providers, nursing homes especially, and even like correctional facilities where you have populations that your employees are around who maybe can't social distance or won't or can't get vaccinated. And so those are the types of employers who are most likely to be able to justify the mandatory vaccination. Certainly the purpose is to limit the exposure to patients, customers, and clients, but you need to reach this threshold, which is that you have a reasonable belief that the vaccination is necessary to ensure employees do not pose a direct threat to the health and safety of themselves or others. And that can be kind of a high bar, given that many of the workplaces have been handling COVID for a year now without a vaccine. Probably the biggest barrier to requiring a vaccination is that right now the vaccines are under this emergency use authorization, and that comes with some risks. It's not FDA approved wholeheartedly yet. And so because of that EUA designation, each individual has to be informed beforehand of the risks in getting the vaccination, that they have the option to accept or refuse a vaccine, and what are the consequences if they refuse. If you're mandating it, what are the consequences you're going to give to your employees if they don't want it and they refuse or they can't have it? You need to think through all of those answers before you decide whether to mandate the vaccination. And employees who do refuse can be excluded from the workplace. You can have them work remotely, or if that's impossible, you can, if you're mandating the vaccine, you can exclude them. If everything else you could try results in what you have determined is an undue hardship. But at this point, it's pretty risky to terminate an employee for refusing a mandatory vaccination. And most of that, I think, is because it's under this emergency use authorization. So what you're looking at then, what do you do if you exclude somebody from the workplace and they can't work remotely? It looks kind of like an unpaid leave. And so that's kind of another barrier to think about if you're trying to mandate the vaccination. If you're mandating, you need to be responsible for paying for it. Right now, the costs are nothing or very minimal, but also potentially pay them for the time they take out of their day to go get it, or if you're having a pod on site, that can be minimized. And you likely need to think about paying them for any recovery they need after getting the vaccination if they suffer from any side effects. You also need to consider whether if you're mandating a vaccination and somebody has a bad reaction, that could wind up being a workers' compensation claim because you mandated that vaccine and they sort of suffered a consequence as a result of in their work, in the scope of their work. Another thing to think about for those who are regularly reporting to OSHA, they've recently determined that an adverse reaction to a mandated vaccine is now going to be termed work-related and has to be recorded. So if you're just encouraging the vaccination and it's voluntary and somebody suffers from side effects, that's not a recordable event according to OSHA here recently. So that's another hurdle, another thing to check off if you are mandating the vaccine. And lastly, what we already talked about was what happens when an employee refuses to get the vaccine. Are you going to terminate? Do you have the capacity to send those folks home or have them work remotely? And what's the morale behind some of these decisions? We've talked earlier about the two exemptions that the EEOC has recognized, which are the disability exemption and the religious exemption. You could ask for the basis for those exemptions. You don't want to dive too far in, but you can ask for, what the basis is for why they are refusing that mandatory vaccination, and then go into that interactive process just like you would any other request for accommodation and see if there is a reasonable accommodation. Normally you'll be able to find one unless there is an undue hardship with respect to the disability exemption. That's a really high threshold. It's a lower threshold on the religious exemption, but most of the time you're going to be able to find one, because those reasonable accommodations are likely things that you have been doing already. You have been asking folks to wear their masks, wear gloves sometimes, or other PPE. A lot of folks, it sounds like Dana has been working remotely for a while to the extent that they can. You could also reassign people to less populated work sites. You can spread them out. A lot of people are exploring with different schedules, having so that half your workforce is working from home on certain days and then they come in on other days, and that spreads everybody out in the office or in your work setting. Also keep in mind the political beliefs are there, and certainly lots of workplaces are finding out how much politics has been affecting people's beliefs about the vaccines, but they're not a reason to request an accommodation. So be careful about how you resolve those things, but know that because they believe based on politics that they don't have to have the vaccine, that's not a request for an accommodation under the law. And then always document all those requests for accommodation, whether they are kind of out there. Those are the ones you probably really want to document so that you can demonstrate that you received this request from an employee and that it was not going to work. And that you were able to resolve it in another way. Okay, if you're like over 95% or so of employers and you're just encouraging folks or leaving those vaccination choices to be voluntary, remember that the employee's decision to answer those pre-screening questions, which can elicit some disability and GINA-related information, that also has to be voluntary. So you don't want to force people to go in and have those questions be answered in a pod, for example. And an employee can refuse to ask those pre-screening questions, but if they do that, you can refuse to administer the vaccine. But you also need to be careful not to shun them or threaten them or intimidate them. You can't be retaliating against folks who are resistant and you haven't mandated it. So you just have to kind of move on and try to persuade them maybe another way. So one thing that I've been seeing more and more of, this is probably what I'd recommend, I think is the safest way and it's the most productive way to encourage folks to get vaccinated, is to give them paid leave to get their vaccination and to give them paid leave if they need to recover if they have side effects. You can limit it. A lot of people I've seen do 2 hours or 4 hours, or if you're providing that pod on site, I think that's a huge benefit to employees. The flip side to this is, are you treating the folks who are not getting the vaccine differently by not offering the same benefit to them? So what a lot of folks are doing now is giving the folks who are resistant to getting the vaccine, giving them paid time to watch an educational video or a safety video. Pick something that will encourage them to get the vaccine, like how great their workplace will be if everyone is vaccinated. What are the benefits to them or to their workplace if they choose to get the vaccination? And you can offer that same opportunity to the folks who are not getting the vaccine. Just as Laura kind of mentioned, make sure to treat this like a wellness program if you're encouraging but not making people get the vaccination. So you don't want to find yourself sort of coercing people into a decision that makes it really hard to decide to say no. If you were offering $5,000 to get the vaccine, that would be a really hard thing to say no to. And that would probably violate the laws related to wellness programs, and that's the vaccination programs are aligning somewhat with the wellness programs as far as we know so far. And then lastly, that tax credit from the most recent Biden administration law passage is likely available for employers who offer paid leave to get the vaccination. Next, try to draft a policy, a written policy about how this all works. You have to apply it neutrally to all employees, whether they're onboarding applicants, long-term employees. Everybody needs to be treated the same. You can request proof of the vaccination. You don't ever want to ask why they did not get vaccinated, because that could elicit that disability-related or GINA-related background information. It sounds like at Dana, they, on the pod, that Rite Aid or whatever pharmacy group handled all of the pre-screening question information, and that's perfect. You don't want that information if you don't need it. So you're not eliciting that information out of your employees. If you're doing a mandatory vaccination, I recommend that you also address the interactive process, so that if they say that they have a disability exemption or a religious exemption, they know that that's part of the process of working through those things. And then also state the consequences of refusing to get the vaccine if you're mandating it, and make it something that you are willing to enforce. If half of your workforce decides that they don't want it and you're mandating it, what is that doing to your ability to keep business going? Union considerations. Always check your collective bargaining agreement. This has to do with a term and condition of work, most likely, especially if you're mandating. Or even if you're not, if you're offering a benefit or some sort of paid leave to folks, you probably need to talk to your union and negotiate some of this stuff. At the very least, you need to notify them of what your plan is. And so always consult that agreement before finalizing everything. Okay, and so finally, communicating with employees. We've talked a little bit about if politics discussions at work become heated, know that you can prohibit people from talking about politics without violating their First Amendment rights. But the NLRA is going to remind you that discussing terms and conditions of work is likely going to be considered concerted activity, protected concerted activity, and you need to be careful about how much restriction you're putting on your employees. And remember, the NLRA applies to union and non-union work environments, so follow those rules. Okay, so if you have a workforce that is mostly or completely vaccinated, can everybody take their masks off? Not quite yet, especially if you're indoors. So continue to wear the mask and social distance. Keep up with the CDC, because I think they're going to be, changing things as spread rates improve or lower. And check on the OSHA guidelines and follow those rules. Just as Brandon advised, if people are feeling sick, send them home. One of the benefits of having being fully vaccinated, according to the CDC, is if you've been exposed but you're not suffering any symptoms, you don't have to quarantine. That can be a huge benefit. That was one of the reasons a colleague of mine decided, oh, maybe it's worth it to get the vaccine, because he's a workaholic. So that was what convinced him. But also remember, try not to distinguish between vaccinated and unvaccinated employees, at least until the CDC says you can. I've had several employer clients come to me recently saying, okay, I have most of my employees who have been vaccinated. This is awesome. I want everybody to be vaccinated. How can I make the rest of them get it done? Or can we separate vaccinated from unvaccinated employees? And that's a tough question, because you really have to balance, are you punishing that part of your workforce by keeping them out of certain spaces, or giving them a raw schedule, or something that you're meant to encourage the folks who have gotten vaccines, but you really have to be careful about treating people differently. And again, communicate so that your employees understand what your intentions are, and you can try to reduce those misunderstandings. Make sure you're enforcing the rules so that they don't feel like they need to call OSHA and report that somebody is not wearing their mask when they should be. If everybody knows what the rules are, and you're enforcing them, that'll certainly help. And that's all. So things are moving, things are changing, but if you're keeping up with the CDC, and Ohio is really doing, I think, a pretty good job of tracking and following right behind the CDC on some of the stuff, and showing people the benefits of getting vaccinated. I think we're gonna hopefully improve. Yeah.
All right. Great, Amy. Thank you. Good information to have there. So I didn't see any questions pop up in the chat. However, I have a whole list of questions that I'll be happy to ask that I think others might be thinking and just haven't put in the chat there yet. So one of them, Amy, you mentioned, I thought was a great suggestion in terms of people who are reluctant to get the vaccine, but may still feel like, hey, how come these other people are getting this extra time off? And you suggested maybe watching some videos, especially on vaccine safety. Are you aware of some of those, or again, I might ask Brandon or Greg that also. Are there some of those videos that are available either through the health department or through the CDC that we could have those employees watch?
Those are exactly the sources I was going to suggest. I know CDC has documentation that's supposed to educate folks on the benefits of the vaccine and the safety behind the vaccine. But I imagine the Lucas County Health Department and other local health departments and the CDC probably has videos as well. I haven't seen them recently, but
Yeah.
documentation I'm aware of.
Yeah. Brandon or Greg, are you aware of any videos that might be available?
There may be some through the B project. I don't think we have produced any directly as the health department, but I can certainly get back to you on that, check on that, and send you some resources.
Okay, great.
And I would just say the CDC, I would look at the videos and education that they have. And then anything, I would also check over the Ohio Department of Health website for any of their educational materials too.
Yeah, I'm pretty sure that there are some on the CDC website, but I obviously all those resources we can check, and Julie, we may want to just add some information on a follow-up email to everybody on that too. So one of the other questions that I had, and I've read through some of the recent CDC recommendations, and some of that I would say is a little bit vague yet. And one of the statements that I saw was that fully vaccinated employees may be no longer required to, and I have to remember the exact terminology, but from going through the routine screening tests. And so I think I know what they're saying. That I think they're saying that, you know, there's some places that are requiring actual COVID tests a couple times a week for like healthcare facilities and those kind of things. So I think that they're probably saying that, but I would love to interpret that as them saying those daily temperature checks or those questions that we've had employees answering every day, that they may not have to go through that every day also. Any input from anybody on that how that might be interpreted?
So I don't want to speak to the interpretation of it per se, because I haven't seen that direct guidance that you referred to, or I want to review it. But I can say that at the department, we've modified some of our protocols in terms of screening, in terms of that. So instead of temperature checking everybody who comes through the door, our clinics will, just as part of the normal clinical routine. But otherwise, we only really do those temperature checks if we know someone's going to be in the building for an extended period of time, or in a face-to-face meeting even. If they're just coming to one of our front desks and everybody's wearing a mask, we're less concerned with that aspect than if somebody is actively like coughing and symptomatic when they come in the door, in which case hopefully they would not come in, but we would say, hey, you look like you're pretty ill. Could you come back another time?
Yeah. Okay. Good. Amy or Greg, any thoughts or input on that?
I think I don't remember if it was the federal legislation or Ohio that they were not requiring those regular tests, except they carved out nursing homes. And I just recall that because I had just talked to somebody who's affected by that industry. And but then I think they maybe clawed that back. So I'm not, I think it's really just important to keep track of what's changing every day. And it seems to be loosening. I mean, hopefully we don't have to tighten back up. So once you figure out things are loosening, then we'll keep on track there.
Okay. So no real clear direction on that yet. Just keep watching for things. Maybe they'll clarify some of that then, is my interpretation then. So I'm going to try to ask one more question because we're almost out of time. And one of the things, Amy, that you mentioned also, and I fully agree with you on this, that about making the vaccines mandatory shouldn't be done probably until we're out of this emergency authorization. Has anybody heard anything about when we might expect to get the fully authorized use for this vaccine? I mean, I think I've heard it could be another year or two before that would happen. Is it any Greg or Brandon, either one of you hear anything different than that?
I haven't heard anything about when the full authorization may come through. I do know they're planning to issue, this is on the horizon, maybe for next week, maybe the next couple, a new EUA for Pfizer for 12 to 15-year-olds.
Okay.
So I do know they're looking into that, and that's probably coming within the next 2 weeks.
Mhm.
But in terms of a full authorization, I have not heard estimates at this time as to when that may arrive.
All right.
I haven't either.
Okay. All right. Very good. Thank you. So Laura, I will ask you one last question. I might run us over 1 minute, but this will be my last one. I promise there. Did you have any reluctance for anybody coming back to get the second dose of the vaccine? Laura, I assume that you've been through both cycles of that now. Is that right?
Yeah, we've actually been through, we're on our third cycle. So
Yeah.
we'll have our next group of second shots next week. We had some, I wouldn't say reluctance. We did have some people that missed, but with that being said, we also had some people that maybe got vaccinated, their first vaccine somewhere else and came to ours for their second.
Okay.
So, I mean, I think it's kind of balanced out, but I think, again, just timing with spring break and some other things, I think people found other solutions. And I think there is Vaccine Finder, I think it's .com. But anyway, you can go in there and ask which vaccine you're looking for, and it will tell you which pharmacies or clinics have that vaccine. So I think that's how some people have been doing that.
Yeah. Okay. All right. Very good. All right. Well, thank you, everyone. I appreciate the information. Appreciate the answering the questions here. Julie, anything else you want to close with here today?
No, nothing to close with. Again, I will just echo the thanks for everybody's time and the great information, and Laura, for your personal story on how you did that. I think when we heard about employers holding their own, like the first thing was like, that's scary. That's probably not something I want to do. But you did, Greg and Laura, for what you shared with us. I think we put some minds at ease about being able to do that. So thank you. Again, we are recording this session, and I will send everybody the link to that when it's ready. Bob, great idea to add some of those video resources, at least where people can find that when we send that link out. And Brandon, I will send that link out, or I'll send out that news release that you just put out about tomorrow's open clinic. So with that, thank you, everybody. We are running a second session like this on May 19th. And again, the information is ever evolving. So we invite you, if you're in here today, to join us again for that one, or share the link to register for that one with colleagues or businesses who you think might be interested in the information. So thank you.
Thank you, everybody.
Thank you.